Let's get started. Hello, everyone, and thank you for joining us for United Way's Volunteer Network's Health Focused Community Connections webinar. My name is Steve Whitman. I'm a product manager with Springs Window Fashions and currently serve as the executive chair for the Business Volunteer Network, or BVN, as we call it for short. I think we have a few other of the BVN executive team with us today. Would you like to introduce yourself, perhaps? Katrina, I thought I saw that you were online. Would you be able to introduce yourself?
Yes, totally not prepared to be on video, but yeah, hi, I'm Katrina. I am the vice chair. I will be the chair next year. So thank you so much for being here. As you can see, I have Halloween decorations still up behind me, so I have some things to do this weekend. So yeah, hi everyone, and thanks for being here.
Great, great. Thank you, Katrina, for introducing yourself. At BVN, we're always looking for new members of our executive team. So if you're thinking about getting involved or would like to join us for an upcoming executive committee meeting and see what it's all about, please reach out to me and let me know. We do work as a collaborative team on most of our efforts. So it's not a huge lift for any one person, and it can also be a lot of fun. All right, today we're going to get down to business here and start talking about health and with our health and community leaders about the well-being of our community. While Dane County remains a top place to live, raise a family, and retire for our BIPOC neighbors, including Black, Indigenous, Latinx, Southeast Asian, and people of color, education, income, and health inequities and disparities remain consistent. We are very fortunate to have some excellent panelists today who will engage in a conversation about challenges our neighbors encounter and suggest ways for you to participate and make a difference. After the panelists are finished, there will be a Q&A session. And with that, unless there's anything else anyone has a concern about, let's get started with our first panelist. Our first panelist today is Uchenna Jones. Uchenna is currently serving as the United Way of Dane County Community Impact Health Director. Uchenna is an experienced labor and delivery nurse, doula, and community leader in supporting health and reducing racial health disparities. She is also an amazing author and runs her own nonprofit on wellness. Please help me welcome Uchenna.
Good afternoon, everyone. I should have asked what you were going to say before you said. It's great to be here. And yeah, so I just, briefly want to talk about like my portfolio, what we do, kind of set the tone, and everybody else will continue moving forward. So in similar fashion as Steve mentioned, so currently across the nation, there are gaps in healthcare. Unfortunately, those gaps are persistent and they're increasing. BIPOC community members are significantly more likely to experience low quality health care, have less access to resources like education, experience prejudice in their professional and their personal lives. And one of these experiences is in the form of stress, which can contribute to a number of medical conditions such as high blood pressure, heart disease, stroke, and eye disease. Wisconsin and Dane County rank high in overall healthcare nationally. However, we still have some of the worst health disparities in the nation. And many of these disparities are rooted in racism. And it also, this deep-rooted racism is also identified as a public health crisis. Additionally, in Dane County, the color of your skin, the zip code in which you live have significant impact on your quality of life expectancy, and a wide range of health outcomes. The evidence is clear and the need is urgent. So our focus, our goal here at United Way is decreasing racial disparities and providing equitable access to affordable, culturally safe, social, and medical health care. The areas of focus are four. The first one is expanding racial trauma support for the BIPOC community, increase community-based care that addresses the BIPOC community, increase community-based maternal child health programming for the BIPOC community, and lastly, reducing racial and health disparities in Dane County by providing culturally relevant care, increasing capacity to address health disparities for BIPOC residents. So at United Way, the way in which we go about providing support is by funding agency partners, nonprofit organizations in the community that promote community well-being, moving and subsequently it moves the work forward. So I don't physically do the work, but funding is allocated for those who are doing the work, and I stay in close communication. So for last year's numbers, just to give you perspective, we supported 15 nonprofit partners, which equals out to be 16 programs, which totals out to be 9,843 participants who were served. And of that number, 87% of those participants saw improved outcomes pertaining that address their needs of the BIPOC community. So, and the breakdown is very specific to the different areas. So what are our biggest challenges? We can never have enough money to do this great work, right? So we do what we can with what we have. How do we measure success? How we do that is we actually collect data during the mid-year and the end of the year in terms of the work that each of our agency partners are doing. The way in which business volunteer networks can be involved, can help is, so like we have a maternal child focus and some stuff like diaper drive. It's low-hanging fruit. People can bring an extra set of diapers or some gently used clothing. You know, we are serving, you know, we have organizations that are serving, you know, birthing people that need those resources, you know, also, you know, it's getting cold outside, you know, so all these different things, other kinds of products, you know, sanitary napkins, you'd be surprised, those things are really pricey. So these are other opportunities. I don't know the extent of what the Business Volunteer Network can do, but gift cards, you know, I mean, we can get pretty creative once we start talking about what types of services that are rendered. I don't know if I need to go specifics in terms of each of the agency partners, but I just want to close out with a story of the impact. You know, we at United Way love telling stories about the work that we do and why we do what we do. So this particular story is actually written from one of the participants who identified as receiving some excellent support from one of the agency partners, which is Roots for Change. And so I'll close out with this. My experience with Roots for Change was amazing. During my first pregnancy, I had no idea what a doula was until my provider informed me of who and what a doula is. I was interested in having a natural birth. My provider recommended Roots for Change to me because she expressed how helpful this organization has been to her previous patients. I also had lots of questions, and sometimes my provider couldn't answer. I also had, when I started to work with Marciela, that's her doula, Marciela took time to answer all my questions, and even if she did not know the answer, she would ask her other colleagues, and they will text or call me the next day to give me the answer. Another thing that was very helpful was that Marciela assisted me in creating my birth plan and making sure it was followed during my labor and birth and delivery. The story took a big turn when we found out that my baby was going to be stillborn. And during that moment, while giving birth to my daughter, Marciela and Ida were very supportive, not only towards me and Brian, my partner, but also to my other family members who were there. We will always be grateful for that. After that unfortunate situation, they took their time to see how I was doing and made sure to tell me how to take care of myself during my postpartum recovery and grief. They also provided me with mental health resources and psychologists to help me process the loss of my daughter, which helped me out a lot. I am currently pregnant with my second baby, and I have made the decision to work with Marciela again because she knows my story. And I know that she'll be a great support during my last month of pregnancy and delivery. I would highly recommend this program to other parents, especially first-time ones. There are also so many things during pregnancy we don't know, and Roots for Change will definitely teach you. So this is just one of many, and supporting our agency partners who are doing great work by providing tangible things or even volunteering their time at their events could be very helpful, not only for the agencies, since sometimes certain agencies have capacity issues, may need more bodies, but also with items that help better serve their communities that are focused. So that's my little spiel, and thank you for having me. And I will pass the mic to Steve.
Thank you, Jenna. Thank you very much for sharing your story and the work that United Way is doing to help try and balance out the disparity in healthcare in our community. It is an alarming situation, and I'm glad that you're focused on it and have a team of people that you're working with. And Roots for Change is a great organization to be working with as well. Next up, we're going to change the focus just a little bit, and our next speaker will be Nicole Wright. Nicole Wright is with Journey Mental Health. Nicole is a licensed professional counselor with a specialty in substance use disorders. Nicole works in the behavioral health field, serving adults, youth, and their families. Nicole is currently the Chief Clinical Officer at Journey Mental Health Center. She is a strategic and innovative leader who is passionate about improving the lives of those in her community. Nicole graduated from Illinois State University with a nutrition and dietetics degree and practiced sports nutrition prior to pursuing a master's degree in community counseling from Winona State University. Please help me welcome Nicole.
Hello, everyone, and thank you, United Way and the Business Volunteer Network, for having me and Journey represented today. Appreciate it very much. And we can start with the slideshow. So I know for the sake of time today, we're going to do a brief overview on Journey to provide some information for those of you who may not know a lot about Journey. And then I'll be addressing some of the questions that were specific for the panel today at the end of the PowerPoint. So next slide, please. So I first wanted to talk a little bit about our mission, vision, and values. We actually created a specific strategic initiative this year and really focused on recreating these areas to really meet where we are right now as an organization. And in terms of our mission, we empower people by providing connections, support, services that meet diverse needs and strengthen the communities we serve. And the vision for us is Journey is a leader in specialized behavioral health services. We're committed to ensuring people's mental health is prioritized and barriers are overcome. And our values are belonging, collaboration, compassion, equity, hope, and integrity. Next slide. Journey at a glance, I thought I would give just a brief rundown of who makes up Journey. And currently we have roughly 16 members on our board of directors. We have roughly 300 plus employees. And in 2022, we provided 11,000 services hours to consumers. Funding sources for 2022 included, we have contracts with Dane County. We have contracts with the state of Wisconsin. We take commercial insurance, donations, and then of course, other payers and resources. Next slide. Some highlights at Journey here. We are a leader in providing community-based specialty behavioral health and trauma-informed services. And currently we are the largest behavioral health provider here in Dane County. We have the contract for Dane County for crisis services. So we provide the 24/7 emergency services for all of Dane County. And last year, we answered 43,000 calls for those in our community. And most recently, you may have heard some information or read the newspaper or watched the news, and you heard about our CARES team, which is Community Alternative Response Emergency Services. So this is a partnership between the City of Madison and Journey, in which we have a paramedic paired up with a clinician from Journey, and we respond and are dispatched to nonviolent mental health related 911 calls. And very specifically for Journey's resilient response to effects of stress and trauma, or the REST program, which is included within that, is CBITS, which is our cognitive behavioral therapy in the schools, in which we have had a very long relationship and received funding for the United Way to help support those programs. We screened over 5,000 students in the area of Dane County in multiple school districts for symptoms of depression and traumatic stress. Next slide. And here, for some of you, this may be very small, and I apologize for that, but I will give you a big overview. This is our continuum of care. And so we provide lots of different services provided in all of these different areas. And particularly, we have 3 areas of service. And so one I spoke a little bit about earlier was our emergency services department. And under that area, we have our 24/7 crisis call center. We have our CARES services. We have our crisis mobilizers. These are folks who will help support consumers in the community after a crisis. We have our embedded law enforcement positions, and where we have clinicians in some of the police departments in the area, and we go out on calls when somebody is having a mental health crisis. We also have Resource Bridge, which is a short-term program. Those who are having need services after a crisis, we come in alongside of them and support them during that and get them connected to services. And then in the area of green, we have our community-based services, and under this area, it does include our comprehensive community services. And so those are our CCS programs, in which it's more of a wraparound style care in which we provide services across the lifespan. So for children, youth, adults, and their family. We also have targeted case management programs in which we come and we provide support, provide resources, assist consumers in getting resources in the community, medications, provide one-on-one support. We also have our community support programs, which is our highest level of care, in which we provide almost weekly to bi-weekly support for consumers who have persistent mental illnesses. And then in the other area, in the blue area, we have our clinic-based services. And this is where our traditional outpatient services reside, in which we have therapy, medication, peer support, case management for those across the lifespan. And under all of these areas, we also provide medication support as well. Next slide. And here's a list of just some of our partners. We have many, so I wanted to have this concise to one slide. There are many others, but here are some just at a glance. And of course, we are a proud partner of United Way. Next slide. And so this just gives you some information about us. We have our website on there and some phone numbers in case you wanted to inquire about services or any other information you might have. And so now I just wanted to transition a little bit into the very specific panel questions now that I gave you a brief overview of what Journey is to our community. And so as I was really thinking about the questions, which really made me reflect on the past year and was, just a good reminder as we start thinking about its budget season and a strategic planning season as we are planning for 2024. And in terms of goals or hope for impact for our community, for us, it's continuing to expand services in our community, also expand services to the BIPOC community members, providing more service on the prevention and early intervention side of things, and really focus on how we can minimize barriers in treatment. We know that sometimes making multiple phone calls to get treatment started is really it really impacts the quickness of services when people really need it the most. So really looking at how we can decrease that to really give consumers the services when they need it the most. And our biggest challenges, probably not unlike many of you, is the workforce. We've had some significant workforce challenges this year. For some of you that are not aware, there's a significant behavioral health workforce shortage here in Wisconsin and across the country. And so for us, it's really been identifying areas where we can try to assist in that workforce shortage. And so we do have an advanced internship program. And so we work with many schools across the state of Wisconsin and also across the nation, and taking in interns and providing them with lots of great training and supervision so they can earn their hours towards their licensure, which will help, hopefully, in a couple of years, increase our workforce. Another area is funding. We've been doing a lot of advocacy this past year, and we have about roughly our funding is 2/3 county contracts. And many years we do RFPs or contracts that last multiple years. And during that, there really isn't any cost of living increase. And so many of our contracts fall flat year after year. And as we all know, the cost of inflation and the cost of particularly salaries most recently has really not currently met the cost of doing business any longer. And so we've been doing a lot of advocacy with our partnering agencies to try to advocate at the state and the local level to try to increase our rates. And in terms of success, I could say lots of different things. I think for us as a community, if we can really meet the needs of the consumers who need it when they need it, our community benefits from that. And I think we see less significant outcomes as it related to medical, and then just community and economic environment pieces. And so I think for us too, we want consumers to have positive outcomes as well. And so if they can continue to learn the skills to manage, to move on along their own recovery journey, that's success for us. And, how can the BVN members be involved? Well, right now we're currently developing a volunteer opportunities. And so we'll be sure to follow up with you all as we solidify those for 2024. And also, if some of you aren't aware, Journey is celebrating their 75th birthday this year. We've been around since 1948, so that's a long time. And so part of that is we will be launching a public fundraising campaign soon. And we have our fund developer on the call today, Missy. And so we're going to be launching that, and we'll also be sure to make sure we give you all of that information. But when we do launch it, if you could share our media posts and follow us on all of our different media areas, that would be wonderful. And of course, if looking to provide a donation, that definitely helps us assist to support our mission, and then of course allow us to continue to meet the community needs. Thank you.
Thank you, Nicole, and happy birthday. Gee, I didn't know we should have had a cake here or something, but I'm sure we'll hear lots more about that in the coming weeks and months. So thank you for sharing that presentation today. Let's go on to our third panelist today. Alicia Henning is with the Beacon. Alicia joined the Catholic Charities of Madison at the Beacon Homeless Resource Center as their volunteer coordinator in November of 2022, and is proud to align with their mission to provide compassionate and caring services to the poor and vulnerable in our communities. Helping people affected by homelessness has been part of Alicia's life since childhood. The principle that taking care of others helps to strengthen the community is something that Alicia lives by in both her personal and professional life. Her refreshing and zestful approach to the volunteering sector, combined with her 15 years of experience, offers a strong and multifaceted foundation to her work. Please help me welcome Alicia.
Hello, everybody. It's great to be here, and thank you, Steve, for that introduction. I would also like to add that since Uchenna brought that up, I also am a certified birth and bereavement doula, so go doulas out there, yes. And my background is in music therapy, so I have a degree in that, and then also certifications to facilitate anger management groups, domestic violence groups, cognitive behavioral groups, and have worked a lot in the past with adult males who were coming out of incarceration as well, and getting them stabilized into the community. So thank you. If you could pull up the slides for me, we'll get started here. All right. So as Steve said, I am the volunteer coordinator here at the Beacon. And for those of you who do not know, the Beacon is a day resource center who serves individuals and families who are experiencing homelessness in Madison and then Dane County surrounding areas. We are open from 8 to 5 p.m. every day of the week, 365 days a year. And we just in October celebrated our 6-year anniversary as being a part of the homelessness services here in Madison. All right, next slide. Okay, so our mission is to provide a safe and supportive environment where guests are empowered to access the resources and opportunities they need to stabilize their lives and overcome homelessness. All right. All right, we definitely are a purpose-built shelter. When we were planning to come into the fabric of Madison here, we compiled a big list of things that we felt were missing in the area. And so here at the Beacon, we have both essential and basic needs that are provided for our folks. We offer breakfast and lunch every day, private showers and hygiene products, laundry services. We have indoor and outdoor day storage that is locked and secured for our guests. The guests are able to use our building as their mailing address. And then also phone services are provided for them. In our second floor of our building, we have a big computer lab that guests can use for both business and personal uses. We have a private area here specifically dedicated to families and guests with children. And then we also help coordinate and offer transportation to both of the men and women's overnight shelters so that folks can get here safely in the morning and that they can get back to where they need to be in the evening. We have also accesses to various services. So we help guests obtain any vital documents that they need. We have representatives and partnering agencies here all the time. They are representing both Medicaid and food share benefit applicants, employment services like FSET. And then we also, to focus just a little bit on the mental health and then medical health services that we provide our guests, we partner with Meritor and Unity Point Health to bring in physicians and nurse practitioners on a weekly basis for our folks to see. They can help guests obtain any medications that they need, both over-the-counter and prescription medications. We do have an exam room here at the Beacon if they need to have something looked at. We also have a program that is a kiosk called Nurse Disrupted. This program was implemented, I would say, about 8 months ago here at the Beacon, but it is a kiosk screen that they can use, and if they choose so, they can click on that, and within 30 seconds, they're connected with a live video chat with a registered nurse practitioner who is there to help triage the questions that they have. If they need to set up continued care in the clinics, they can go ahead and schedule those appointments for those folks. And then also, if at any point a guest is using that kiosk and has any type of self-harm or harm to other statements that are brought out, then that nurse practitioner goes ahead and calls our staff right away to alert us of that, to handle that person's needs where they're at. We also are under a 3-month grant right now where we can offer individual telehealth appointments with a licensed therapist, so that if folks want to get connected and have mental health appointments, then they can do that here as well. All right, we have housing navigation here as well. And then we also have representatives from local alcohol and drug treatment facilities who come in if folks are interested in seeking any kind of substance use treatment. All right, next slide. Okay, so our goal and our hope for impact in the community, it really is to support and assist those individuals experiencing homelessness in Madison and Dane County through offering those resources and the partnering agencies that help with opportunities that lead to the stabilization for them. We also have the goal to continue to build and strengthen our relationship with our residential neighbors and also our business neighbors. We want to make sure that we stress that we work as a community here, and that it really does take all community members on board to support an organization like the Beacon. And so those relationships and support are very important to us. We also have continued and will continue to even more strengthen our relationship with the Madison Police Department. But I would say that in the 6-year history, we have the best relationship with MPD right now that we have ever had. So it's wonderful to receive their support in working together to help our the needs of our guests. Okay. All right, so just kind of to give you a snapshot of who we have been seeing, the first pie graph there is just our average demographics, so you can get an idea. And this is just for the last 3 months that I took this data from. So you can see that we primarily serve male guests, and then women, and then it's a smaller percentage for both children and then anybody who has a gender identity other than male or female. So you can just kind of see how that's broken down. And then the next bar graph over there, line graph, is the average guest visits per month. And I wanted to give you guys an idea of what we are seeing here at the Beacon and other homelessness services in the Madison area. But I have our average numbers from 2022, and then I have our average numbers for 2023. So you can see that we have had an average of a 50% increase from last year to this year. And there were a few things that have contributed to that increase. Last year, two of the main things that we did notice that we had last year that we don't this year in the community is the COVID hotel that was open and used, and then the pandemic hotel that was open and used, both to support the homeless population in Madison. Those no longer are open. And there are other factors that go into the increase, but I just wanted to point that out as we're looking at those figures. All right. Okay, so our service impact here, due to the numbers of guests that we're serving and the increased number, our service impact population has changed over the years from when we opened to currently. Back when we opened, you can see that the focus was to assist individuals currently experiencing and or at risk of experiencing homelessness. And what we know is that we're really making that shift due to those higher numbers to only focus to assist individuals who are currently experiencing homelessness. I do have some pictures there since I am the volunteer coordinator of our 3 main volunteer areas. So we have volunteers up in the top who are in our laundry room, busy doing guest laundry. I have a picture of our guests in our kitchen, and then some guests who are working out of our shower room area. So just to give you an idea of a few shots from the inside, and then we have the outside of the Beacon and a picture of guests lined up there to come in for the day. All right. Our biggest challenges, I would say, as an organization, the first one is our staff to guest ratio. So our ratio is 40-1, and as the guest numbers have gone up, the staff numbers have stayed the same. So I know that already the idea of staffing shortages has been talked about, but I would like to second that we see that here at the Beacon. Another big challenge is just maintaining safety in the building. That really is our primary goal, to make sure that all of our guests who utilize the space are safe. And with those larger numbers increased, we definitely are aware that people are have less personal space here. Things can get heated. And so we want to make sure that we address that challenge for the safety in the building. New guest intakes has been another big challenge for us. So as you can see, for July through September of this year, we were averaging 145 new guests per month. And this is a number I know that the overnight shelters have also seen the trend. In the summer, the uptick of new intakes really spiked. And so we're predicting that that will continue, of course, through the colder months and into the spring. Another challenge is having the time to get the guests connected to services and completing follow-ups for them. And so this falls on our guest services staff who are working here day to day, When they complete an intake with our new guests, they take down information on what needs they have and again, what partnering agencies would be beneficial to meet those needs. But with a ratio of 40-1, we do the best we can with making sure that we can get those guests connected to said services, and following up with them is a challenge. The other big challenge is building rapport with our guests. So we know that having a good rapport with our guests is the primary way to keep our buildings safe and secure. And so that is always on our mind, to make sure that we're building rapport using trauma-informed care approaches when working with our guests here at the Beacon. All right. Okay, so some of the ways that we measure success here at the Beacon is being able to serve the number of guests that we do daily. We are about 223 guests average for the month of September, so that's the most recent month here. And it's an amazing feat, I think, to be able to serve that many folks a day. Another success story is that we have not had any major incidents. So being able to partner again really closely with the crisis team, with Madison Police Department, has helped to maintain, again, that level of safety here in the building. The recent strengthening of relationships with our neighbors has been really exciting to see as well. We have great relationships with MG&E, whose properties are located around the Beacon, and then also Festival Foods. They've been an absolute wonderful ally for us here at the Beacon, and I know that our guests speak very highly of how they're treated when they are shopping at Festival Foods. So again, it's important to strengthen those relationships with our neighbors. I did talk again, just mention again the police department and how absolutely wonderful the officers have been here working with us at the Beacon. And then we also measure success by conducting quarterly guest surveys, handing those out, and then taking in the data that is provided when we conduct those surveys. All right. So some ways that the Business Volunteer Network members could be involved. The first one is to volunteer your time here at the Beacon. So some options are to create a group of volunteers from your business organization to serve a meal on a monthly basis. We have a lot of companies who come in and do that. They decide they want to serve a lunch one time a month, and that is a huge help for us. We also have folks who sign up for volunteer shifts individually, so that could be an option. You could also host a beautification group for our grounds, and just making sure that the outside is as beautiful as the inside is. So just taking care of those outside grounds and helping be a good neighbor in our community. Support us through item donations of daily need. So we are always looking for travel size hygiene products. I have some ideas there listed, like shampoo, conditioner, lotion, deodorant, toothpaste, toothbrushes, soap, body wash. And then we also are always looking for both men's and women's underwear, women's bras, and then adult socks. You can also support us through monetary donations. So you could sponsor the cost of a meal in your business's name. You could also send monetary donations made out to the Beacon specifically, so that those funds can be used directly here. All right. Okay, and I have to just say again, because I'm the volunteer coordinator, that the volunteers here are really the heart of the Beacon. 60% of our volunteers have been with us since we opened in 2017. And then again, we have current volunteer areas in kitchen, showers, and laundry. And all those areas are 100% volunteer ran. Small steps lead to big results. I know that we can feel at times that the work that we do is so small, and we want to see results. We want to see something bigger as a larger picture. So just to give you the average volunteer numbers for July through September of 2023. We averaged 93 volunteers per month, averaged 714 service hours that those volunteers were able to donate their time to. 601 showers were provided, 886 loads of laundry are done, and these are again monthly averages. And then in total, 11,070 breakfast meals were served and 10,775 lunch meals were served. So I love to see those numbers again, because it just kind of magnifies the big impact, the larger picture that small volunteer shifts can make. All right. If you're interested in exploring any volunteer opportunities, donating funds, or donating supplies, I do have our website listed there where you can fill out a volunteer application. If we have business organizations come in as a group, there is only one person who needs to attend that orientation, and then they can be a group leader for the group who's coming in to volunteer any shifts. And then also we have Catholic Charities of Madison, the Beacon Ways to Give. If you click on that link then and go there, you will be connected with both monetary ways to give and applications that you can submit right online, and then also the link to our Amazon wish list, which we update on a regular basis based off of the time of year. So, all right. My contact information is up there if you ever want to get in touch with me directly, or if you have more questions about ways that your business can help the Beacon. Email or phone is fine with me. And that wraps up my slides. Again, I just want to thank you guys for inviting me to be a panelist here today. And thank you all for attending the meeting. I appreciate it.
Yeah, thank you, Alicia. So good to hear from each of you and the different perspectives and expertise that you bring to this panel. For those who I haven't met, my name is Hannah Stoll. I'm the director of our corporate and community engagement department here at United Way. So I oversee the Business Volunteer Network and get to work really closely with our committee, just planning all of these different events and things. But we're going to get into a general Q&A session for all of the panelists. So if there's anyone here who has any questions, you can either interrupt me, raise your hand, or put it in the chat. We've got folks monitoring that too. But, you know, I think from my perspective, running the volunteer center and talking about health, I hope you all are able to see kind of the umbrella of how it's all intertwined and connected. You know, just has health in general is such a broad topic, but really it sounds too like we're extra just in conversation. It sounds like we're really getting into the nitty-gritties of, you know, yes, health in general, but mental health as well. For many of the panelists, have you seen, I appreciate all of the different perspectives again, have you seen any, you all spoke to your challenges, but any recent kind of surprising points, I guess, of, you know, challenges in the work, or data points that have surprised you with the work that you're doing? Does that question make sense? I guess in my world, when we talk about volunteering, it's, you know, you've definitely been able to see trends and things that have just changed over the course of the last few years and different challenges from that angle. But I'm curious from a health perspective.
I know as far as what we're seeing current trends at the Beacon, I would say that the largest number or kind of section increase that we're noticing is the elderly population. And we do have a lot of both medically and mental health wise complex guests here. And that just continues to rise as we're seeing that geriatric population increase specifically.
Yeah.
I was just going to, you know, ditto to what Alicia was sharing, as we've really seen an increase in the needs of those older adults. And so we've been partnering, there's this local steering committee, and we've been partnering with other community providers to really support the consumers in the community to really try to support their needs, whether it's mental health or it's some other type of organic medical issue that's impacting their symptomology, and just really linking them to supports. And our crisis unit has absolutely seen an increase in call volume as it relates to the 65 plus in that area. And so we've really just been trying to utilize all the resources we can, knowing that I think there's also just a greater need than we can handle too.
Yeah, absolutely. And then also you kind of all had some commonalities around working with the Madison Police Department in particular, but Dane County wide. I'm curious, do you all ever utilize each other's resources? For example, like would Catholic Charities of the Beacon, would you guys ever give is it Journey Mental Health that you're calling, and how does do your worlds intertwine?
Yeah, I mean, in terms of, I can speak from my perspective. I was on so there's been multiple kind of groups together. So the Beacon had a coalition group. I can't recall what the name of it is, but I'm part of that, the advisory committee for the Beacon. I sit on that. And now I think it's been renamed to the Madison Community. I'm not exactly sure in the name. I kind of show up and then talk about how we can help each other. But yes, absolutely. And I know we've had some partnership with the Beacon in the past, and also have provided some trainings for staff on site. And yeah, absolutely. We have our consumers who visit the Beacon on a regular basis, and then work with our case managers and our clinicians in the community to support those who are at the Beacon during those hours.
And then we've got a question in the chat, and I believe this will probably be more for you, Alicia, but what size of the groups can you accommodate for volunteer projects?
So our kitchen is our largest space if we're just doing the day-to-day volunteer areas, and we can accommodate for, I would say, no more than 7 people at a time. I do know that some business organizations have a group of maybe 20 volunteers, and then they cycle through. So they pick their monthly or bi-monthly lunches, and then they send 4 at a time, and they kind of cycle through, shift through. But if we were talking about doing more a standalone volunteer opportunity, we have our ELF crew coming up the first Saturday evening after the Beacon closes after Thanksgiving, where we're going to be decorating both floors of the Beacon for the holidays. That's something where we could require 20 volunteers to be able to come in, or also, the beautification of the grounds could definitely accommodate for, I would say, 20 people to be able to help with something like that.
Perfect. Yes. And Journey, as you all are, solidifying what your volunteer program will look like, please keep us in the loop, because the idea here too is that BVN is kind of a foot in the door to a bunch of different companies. And so these are folks who are committed to representing their organizations and hopefully taking it back to their groups and bringing the folks to make it happen. We've got about 3 minutes before we got to start closing. Does anyone have any other questions? Oh, Katrina. The question for you, China, are there certain groups that need assistance, to your knowledge?
Yes, but what happened is, because of the nature, I didn't get a chance to reach out to all of my agency partners. I only know just some of the current, and there might be some things that I don't know because of the planning and where things are. I just hit on the high level, anything infant, baby, children related, that is a big need. It's a growing need, and it's something that comes up quite a bit. So like even having something like a drive, even if it's quarterly or something, that's huge, because we can spread them across the different agency partners that are doing access. Is one of our agency partners that we support. We support Reach for Change through Centro Hispano, and then we also support the Foundation of Black Women's Wellness. So it's big, so that's the one that's kind of like on the forefront. There's other nuances. We also in partnership with Journey, who's also like cross-collaborating with the Reading, the Rainbow Project. I don't know why I keep saying the Reading Project. The Rainbow Project and ooh, they're gonna kill me if I don't mention them too, Catholic Charities as well. And yeah, so we have like agencies that kind of work together, overlap together. But I've never specifically asked, what is it specifically that you need? It's usually when I meet with them, certain things rise to the surface, and sometimes we may need bodies. One of the things I want to speak to across the agency partners that I've heard over the last 2 years is capacity. These organizations are doing amazing work, but they don't have bodies to actually carry forth the work. So if you can indulge me, it's like the harvest is plenty, but the laborers are few. And certain programs didn't get a chance to start the way it needed to because they didn't have the right person in there because turnover. And, these are things that I know some of the agency partners were hesitant to actually speak upon, but have come across. So even if, there's opportunities to participate in certain things where we need bodies to get things done, that is another form of volunteerism that's really important. And then there's also philanthropic events where people can show up and there's like a minimum fee that can go to a particular organization. That's another low-hanging fruit, but something that can be very beneficial to the agency partners that are doing amazing work. So those are my 2 cents.
That's a great point, Uchenna, and thank you for mentioning it, talking about just needing the bodies and the capacity. And a lot of times too, and Alicia, you talked about the onboarding, and if you could just have that one group leader that's consistent each week, just having, rotating folks. It doesn't have to be the same person every month, but those long-term committed volunteers is definitely, because it's the training, right? When you onboard someone, it takes so much time, and then just once they get it down, they head out, so having folks who are really committed is definitely something that we hear a lot from the Volunteer Center as well. Okay, well, thank you all. I'll pass it back to Steve to wrap us up, but that was a great discussion. And I definitely learned some new things just from hearing from you all. So Steve, take it away.
Thank you, Hannah. And I agree. I learned so much today. Some things about from each of our panelists today. So I thank you so much for joining this event and speaking about your organizations and about the community. As you know, this is being recorded, so we all will be sharing it out to a wider group as well. So don't be dismayed by the relatively moderate number of people that we have on the call today, because it will be shared out to a larger group. And many of us will take this back to our groups and our organizations to share some of the needs that you've identified and opportunities with larger groups as well. So we are a small group perhaps, but we are mighty. Anyway, we have some things coming up in the next coming months. Some of the things include the holiday wish list. So as many of you are aware, each year United Way puts together a holiday wish list on volunteeryourtime.org for holiday volunteerism, donations, and all things that are going on kind of through the holiday season of the year. And it gives the people in our community the opportunity to share the giving spirit with others during the holiday season. This year marks the 3rd year that United Way of Dane County has partnered with the Marine Corps Reserve Toys for Tots program. Maybe you've already seen some of the barrels or boxes, I should say, around the community collecting toys. They need volunteers to help sort and organize toys to be delivered to each community partner who is hosting a Toys for Tots distribution. For BVN members, you have an exclusive opportunity to sign up for a volunteer shift before they open to the public on November 6th. If you're looking to connect with your fellow BVN members, please sign up for the November 28th shift from 1 to 3 p.m. A couple of us have already signed up for that to go over and sort and organize some of the toys that come in from Toys for Tots. And I think that those links have been the links to the Toys for Tots volunteer list and the holiday wish list have been put into the chat if you care to follow up on those. There are other shifts, obviously, besides the one on the 28th, which happens to be Giving Tuesday, I believe, to sign up for. And there are shifts, I believe, from 9 to 11 and 1 to 3, most weekdays through December 6th, I think. So lots of opportunity to volunteer and check out the holiday wish list for other things in the community to volunteer for. If you have other questions about BVN or would consider becoming part of our executive committee, like as I said at the outset, please reach out and let us know, and we would love to follow up with you. Again, thank you so much to all of the panelists today. I really appreciate the time you took to share with us and talk about your organizations. Does anybody have anything else they would like to share before we close the webinar today?
Thank you for having me, Steve, and thank you all again. This was great.
Agreed. Same thing. Thank you for having the opportunity to present.
Thank
You're
you.
welcome. Yes, yes, you're welcome very much. All right, well, enjoy the rest of your afternoon and the rest of your week. Thank you very much.
Thank you all.
Thank you.